so I thought actually, can we set this, we're going to do, I thought 10 minutes for the discussion and then 10 minutes for the injection. So if we've got that, I'll talk fast. But anyway, where's the... Okay. So today, I can't tell you enough how people want to have beautiful lips. The fuller, the powdier, the more voluptuous the lips, women and men are considered more attractive. The better the lips, the better the kiss. And today, I'm sure this slide is a little bit dated, and it goes well over $20 billion that the American public spends on cosmetics, but basically, definitely more than $3.4 billion a year on lipstick and lipstick products. All of the ads you see in the women's magazines always have beautiful women, beautiful lips, beautiful color on their lips. And the truth is that even in a recession, which is something, you know, the last few years, women will find a way to still buy a really nice lipstick. There's something called the lipstick index. You know, even during World War II, women were still buying the lipstick to make them feel better. It was a luxury purchase that still had a lower price point. They would even splurge on the lipstick and pay a little bit more because it made them feel better. Same thing I find with nails. Women sometimes find a way to do the manicure, find a way to have nice lips. And nowadays, it goes with, I guess, what's in style and what's in style. But it seems today that men are starting to look a lot more like women in terms of when you look at magazines, men often will have very full lips, more so than years before. Especially, it's a sign of youth. And it's no wonder that these two found each other. They're both kind of known as icons of having really wonderful lips. It's no wonder that their biologic child also has beautiful lips. And across all ethnicities, I think we value beautiful lips. Some people genetically are going to have thicker lips, but the point is that I think lips are valued in every society, and as we age, if the lips get thinner, we want to replace volume because it's a sign of youth, but we want to do it in an appropriate way to not look laughable or like a duck. People of color don't tend to lose the volume in their lips that Caucasians do. You can look at an elderly black woman that might be in her 70s and she still may have really nice volume in the lips, whereas that's usually not the case in Fitzpatrick type 1, 2, 3 people. Don't forget that as we age, you know, some people, first of all, postmenopausally, you have resorption of the bone. Some people really have dental problems, and that adds to insult to injury. We talked before about gravity and just all of the changes that make the face more boxy and more vertical, and so you have a lengthening of the cutaneous portion of the upper lip, and in some cases, the lip almost seemingly starts to disappear. And you can see once again the distinction in fullness, youth versus getting older. So is there a perfect lip? Because I don't really believe that there's a one-size-fits-all, because we all have different faces, and but you can go back and look at Da Vinci's classic proportions, and one of the things that seems to hold true in nature and across all races is that proportions. And if you look at the face, theoretically, we can divide the face into thirds, and I call your attention mainly to the lower third now, between the nostrils and down to the tip of the chin. And if you divide that further, theoretically, what looks nice and in proportion is that the cutaneous portion of the upper lip would be 1/3 vertical distance, and from the commissure down to the chin would be 2/3. And these are just basic principles that are beauty. Now I call your attention to the vermilion itself, and in ideal beauty proportions, you can read, you want to have a vertical height of the lower lip that is higher than the upper lip. And many people don't know that, but in theory, it should be a 1.4-to-1 ratio lower to upper. So when patients come in, very often they're losing volume in the lip, and they'll point absolutely to their upper lip, and that's what they want to volumize. It takes a little while to educate patients that you want to do the right thing, and you have to educate them, because you can't have a really high vertical height upper lip that doesn't match the lower lip. Okay, here's sort of the wrong ratio because of the lengthening of her cutaneous portion of her upper lip. We already talked about the shape of the face changing. Sadly, this is the same woman. Look at her in her 20s and now look at her in her 80s, and of course, a lot happens. Of course, this is an example of the wrong ratio. This is, fortunately, became my patient, but this work was done elsewhere. And you can just see how when the vertical height of the upper lip is double the lower lip, you look laughable. She has a very exaggerated white roll, and now we have to look in profile because many patients, all people, can't really see their own profile. And you have to educate women. They come in, and what you want, ideally, is you want to drop a line basically from the base of the columella down to the chin, and you want the upper lip to protrude a bit over the lower lip, but not very much. And you can see here 3.5 millimeters upper, 2.2 millimeters lower in ideal beauty, if you will. And so you want to educate your patient, have this discussion before. And here's that same woman with the wrong ratio, and if you look at her from the profile, I mean, it really looks duck-like. We don't want to create that, and every patient will tell you they don't want to happen to them what happened to, and they'll either name someone, a movie star, or someone that they know that they've seen that. And this is obviously definitely what we don't want. And sadly, there are people walking around like that. This woman came in for something else, but I just couldn't resist taking the photo of her lip. So how do we define beauty? Is it perfect? And I just want to say that, for instance, Julia Roberts to me is a very, very beautiful woman. Her smile lights up the room. If you look at her in this particular photo, you can see that her upper lip is very flat. She really doesn't have well-developed philtrum columns. She doesn't have a real Cupid's bow. Of course, when you smile, you don't see as much Cupid's bow. And then the vertical height between her columella and her vermilion of the upper lip is very narrow. But that happens when you smile, but not to the degree. But I still think she's very beautiful, and she doesn't have a classically beautiful lip. Here's a woman picked because of her beauty, and you can see how thin her upper lip is, and yet she's very beautiful. You can also see the ptosis of her upper eyelid, and she's very beautiful. So I think there's all forms of beauty. But what's in style today, I would have to say, are very strong philtrum columns, as Dr. Taub alluded to, the bridge to kind of hold up the vermilion. I call them just the columns that are holding up the lip. And then nice plump lips, but not overdone. Back in the 20s, that wasn't in style. What was in style in the 20s was Clara Bow was the it girl back then, and she was known for her bee-stung lips, and women only colored in the central portion of the lip with the lipstick, which is not what's done today. I think today Penelope Cruz might be considered to me the it girl for lips. If you really look, she has very strong philtrum columns. You can see her defined philtrum dimple, and then you see her lips. You see on the cover of all the magazines, people want to sort of emulate that look, that sculpted look. Men, even in the ads, are getting that, and I think a lot of it starts with those philtrum columns. So if you want to really get good at lips, we have to know our anatomy. We already heard from Dr. Posner left-handedly that derms were doing better at anatomy lately, so I encourage you to keep along that path. And know your anatomy, and so when you're reading articles, you can definitely understand. In the old days, when I first was a resident, all we had was collagen. That was the only filler, and we were taught, start at one commissure and just go straight with your injection from commissure to commissure. Well, that's clearly not the technique that I would want to employ today with these HAs, and I think that that is what creates the duck lip and the weird look. So I kind of came up with what I call 6 steps to the perfect lip. It's not going to be for every patient every time, but I think it's a baseline that you can sink your teeth into, no pun intended, and use when you're first starting. And there's a little bit more details in an article from Aesthetic Surgery Journal that I co-authored with my husband September, October 2008. I like hyaluronic acid as my filler of choice. I like it because it is reversible should you get in any trouble. I think that you have to have your hyaluronidase, as we learned yesterday, in the office just in case, and nitrile paste is also useful to have in the office. You definitely need your consent. You want to take the batch number and record it in the chart from the HA. Here I have used a 30-gauge needle. I've evolved, and I actually prefer a 27 half-inch needle. I'll show you when we actually do it. I would give antiviral medication at the beginning, maybe to everybody. It can't hurt. If there's any asymmetry before you start, I think it's key to have a mirror in the room and be on the same page with your patient and point out that asymmetry before you start and make an effort to maybe help correct that. And really quickly, I happen to use topical BLT. You can do nerve blocks, but I honestly feel a half hour with BLT and maybe hurricane gel on the mucosal aspect is all you really need. Then I love to stand at the head of the table, so I'll show you that in a minute. I do that because I'm more objective standing there, and I feel that I can administer the care better, and I'll show you how. I usually kind of put my fingers together medially and pinch, and that sort of helps tell me where my philtrum columns kind of should be if the patient doesn't have good philtrum columns to begin with. So I'm going to stand at the head, as you're going to see in a minute, and the first thing I'm going to do is try to create the philtrum columns, or either enhance what the patient has already or kind of create what they once had. And then I like to pinch because it hurts less, and I am going to just administer one column to the right, one column to the left. And then the next step is I'm going to create Cupid's bow, that nice heart shape, and I like a vertical injection there in the vermilion, so you'll see me do that. And after we do that, there's one going in. Then after that, the third step for me is to define the vermilion border a little bit, and I really only like to do it medially in general, not too laterally. I think lateral you get what looks more like a duck or a sausage shape, and medially you get more of a diamond shape to the lip, which to me is more aesthetically pleasing. I like to pinch again, it hurts less, so you'll see me put it on one side, you'll see me put it on the other side. Then the step 4, I like to make tubercles on the lower lip. You don't really want to do the central portion of the lip, you want a little, quote, pillow on each side of the midline, and that's just a little depot injection. And then, after that, I like to bolster the commissure on each side because many women, it's like a downturned corner, and by bolstering it up, it's a more pleasing shape. And lastly, the nasolabial folds are very important to how the lip will evert, and you have to look at the patient and realize that sometimes that's the key, the final step. Know your anatomy very, very well. Let's not forget that sometimes people have dynamic ritides, and using a neurotoxin in conjunction with filler is very helpful. In this particular case, I pulled out this photo to show you that I have already done perioral laser resurfacing with a CO2 laser. As you saw the demonstration the other day, I happen to use the dot therapy. After that, I am going to enhance the lip, and then the final step is I can put some neurotoxin on those vertical ritides. So all of that to me is compatible at one treatment session, and what you want, you're aiming for natural results. At the beginning, they still will be a little swollen. You have to warn them about that, and they might be a little bit bruised, but I think the results are very gratifying, and I'm going to show you what I do now.
Debbie, while you're getting set up,
Sure.
A few questions for you.
Sure.
First of all, what is the title of your article in Aesthetic Surgical Journal?
Oh dear. Don't know. Google Sarnoff and Gotkin.
Okay.
Lips.
Okay. Any differences in augmentation of the male versus the female lip?
Yes. I think with males, you know, the same way a brow would be flat, and with a woman you're elevating, you want the man to still look masculine. So we have a conversation about it, but I wouldn't maybe augment to the degree that I would a woman.